Hi, and welcome to my channel, All Things BBL, where I go over everything related to the BBL surgery. In today's video, I'm going to go over the pros and cons of choosing my surgeon and just my overall experience and how everything went with my surgeon. And in this video, I'll also try and include a body update. I'm almost 5 weeks, so stay tuned to the end for that. So my doctor is Dr. Jonathan Fisher in Miami, Florida. I had surgery with him on May 25th, 2021. My package included lipo 360, which is lipo from your stomach, lipo in your lower back, and lipo in your upper back, with fat transferred to your hips and to your butt. And my package included 1 faja, lipo foam boards, and 5 massages at their office. At the time of my surgery, I paid $8,500. And I will say the pros of my doctor: he's amazing, great bedside manner. He's very funny, very honest, and he really lets you know what he can and can't do. He's not gonna hype you up and say he can give you such and such a body. He's gonna be very honest with you. So that is definitely one of the pros. And another great thing about my doctor is he's very safe. He makes sure that you're healthy enough to have the surgery. And on surgery day was the first day that I met him, but he took a lot of time to go over everything with me. We went through my medical history, and then we went through my wants and how I wanted to look. He looked at the wish pictures that I bought in for him. And I actually told him I wanted to have the butt of a stripper. I wanted a super big butt. But he did take one look at me and said, you know, I didn't have enough fat for that. And also my butt skin was too tight to put a lot of fat in my butt. So he was very honest with me in what he can deliver, especially this being my first round of the BBL. And I did like how he did take the wish pictures in with him to the surgery. Not that I was gonna look exactly like the wish pictures, but at least it showed him an idea of what I was looking for. And again, I didn't feel rushed at all. And another great thing, in addition to meeting the surgeon on surgery day, I also saw him on my first day post-op. So he looked me over to make sure everything was healing fine, and it was great. You know, I didn't have any complications, so I didn't mind that I didn't get a chance to see him for the rest of the time that I was in Miami, which was 7 days. But I'm sure if a problem arises, he's available to come see you. But again, thank goodness I had no complications, so I only had to see him on the day of surgery and then my first day post-op. And now their office is very clean, very modern looking, and what I like about their office and the way they space their appointments, the office is quiet. You're never in there with a whole bunch of people having to wait for seats, which is like what I heard from some other Miami doctors. It's just like an assembly line in their waiting room. Their waiting room is so peaceful and quiet, and the most amount of people I ever saw in there was one other person. So that's definitely a plus. Another great thing with Dr. Fisher is his office staff. For the booking process, everything was from beginning to end. Everything was handled through email. I never had to speak with them on the phone. And then they actually set you up in this internet portal where they keep you updated on what you need to get done, you know, what's upcoming. So everything is done through this internet portal, and they communicate with you through email, and they get back to you very quickly. But I will say the one downside is medical clearance. For me, medical clearance took a long time. Normally you get your blood work done 30 days before surgery, and then that gives them time to review things and also to get back to you and say, oh, hey, we need another test done. So for me, I didn't get cleared until 7 days before my surgery date. And again, I was traveling. I had already booked everything. So up until the 7 days before my surgery, I was in limbo with the medical clearance, trying to find out what was going on. Again, there was some issues with my doctor, what my doctor wrote on the clearance, and then Dr. Fisher's office wanting more information, so me having to go back to my doctor to get more information. So that's why they tell you to get the medical clearance to start the process 30 days before surgery. And what I would also suggest is, if your surgery is not in for another 6 months, I would say, for one, if you don't have a primary care physician, go find a primary care physician. and just go get a standard blood test. I think it's called CBC, and also have them test your iron and have them test your blood clots, how you blood clot. So do that like 6 months ahead of time just to see if you're gonna have any issues. So at least you know once your 30 days comes, at least you know you're not gonna have any surprises. So that's a huge plus to know about. So the con with the office is if you do have any issues on your medical background, you will get delayed and it will take time to get cleared. So this could be a pro or a con, but Dr. Fisher is known for giving very natural results. He's not known for giving the vixen look. I'll show you, try and put in a picture of the vixen look, which is a very exaggerated hips, very exaggerated butt. Especially if it's your first time, you have to come in with realistic expectations. And also in the state of Florida, they're only allowed to remove 4 liters of fat from your body. So if you're coming in with not that much fat and you're expecting a big butt or a lot of hips, that's not gonna happen because again, the state of Florida limits the amount of fat that can be taken out. So for me, he took out 3,000 cc or 3 liters of fat, or the 3,000 cc's of fat, and he put into my butt cheeks 1,500 each. So that's considered on the lower end because in my surgery group on Facebook, some girls get put back in their butt 1,900 cc's of fat. So I got put back in 1,500 cc's of fat, and my results are pretty natural looking. So I'll try and insert some pictures of my before and afters. So again, if it's your first round and you don't have a lot of fat on your body, you're not gonna come out with the vixen look. Now you can come out with the vixen look if you do have more fat on your body, and I noticed shorter girls can tend to have that vixen look from Dr. Fisher. If they are heavier and shorter, they can get that, exaggerated hips and tight waist. Me, I'm very tall, well, not very tall, I'm 5'7", and I went in at 166 pounds. I wish I would have gained more weight because as I said before, he took out 3 liters. He could have if I would have gained more weight, he could have taken out 4 liters. So I wish I would have gained more weight for the surgery, but overall, I'm definitely very satisfied. And the staff in the office, they're very friendly. Like once you get through your medical clearance issues, if you have any, once you're down in Miami and you're in the office, the staff, they're very friendly. They actually get to know you by name, like on the second date. And again, my package included 5 massages. So I was in the office for 5 consecutive days after my surgery, and I got to know my masseuse very well, and she was very sweet, very accommodating. And then on the last day that you're there, when you have to get your drain removed, I got my drain removed and my stitches removed by the nurse. Again, on that last day, I didn't see the doctor after my first day post-op. So on that last day when I'm getting my drains and stitches removed, that was all done by the nurse, but she was very friendly, very knowledgeable, and overall the staff was very great once you're down there. So bottom line, if you're looking for a very safe doctor, a doctor who listens to your needs, with an office staff that's very friendly and that's not chaotic in the office, then definitely I would highly recommend Dr. Fisher. But of course, do your research, join some Facebook groups, look at their Instagram pages. But I'm very happy with my results and I highly recommend Dr. Fisher. So here's my almost 5-week update. This is the first day that I'm not wearing my faja. I just have a waist trainer on with the tank top on underneath it. I just needed a break from the faja. I've been in that faja 24/7 and I just needed a break. But here's me in some shorts. So from the side, you can't really tell because this waist trainer makes me look a little bulky. But from the back, my shorts, I don't know if you can really see it so much. Side, and then back to the front. My hips are very narrow still. Again, as I said in my other video, my hips definitely went away. But the butt at 5 weeks, almost 5 weeks, is still pretty solid. It's not moving at all. but I do like the way these shorts fit. Here you'll see a difference in how I look in underwear. I think in underwear, of course, my butt should look bigger, so it definitely does look bigger. These are like my update underwear that I always wear. So you see from the side, still don't have projection. I think this is the most projection I'm gonna get. It's not gonna change. And then from the back, doesn't really move. Still not moving yet. Side. And back to the front. Again, this is almost 5 weeks. I'm out of my faja, but I do have my waist trainer on. And yeah, let's hope that this butt gets a little more jiggly. It's still not moving. But again, as you can see in underwear, you can see it more prominently. Whereas in the shorts, I think it was hard to see my butt in the shorts. So yeah, very natural results. Thank you so much for watching. Make sure you leave a comment below. Let me know if you have any more questions that you would like me to cover in future videos. Make sure you like the video and also subscribe, because I'm going to be trying to add content on a more frequent basis.